enough information from stroke neurology, Dr. P N Renjen, where we have talked about various aspects of stroke. Today, on the Facebook Live, I will speak certain broad guidelines, and then I'll be too glad to answer your questions. First of all, what is a stroke? A stroke is a catastrophic vascular event which occurs, and predominantly there are two types of stroke. One is the ischemic stroke, which occurs because of a clot in the brain. And the second type of stroke is a hemorrhagic stroke, when there is a hemorrhage in the brain, as a result of which the artery bursts in the brain and there is blood in the brain. The signs and symptoms of stroke do not differ very widely from an ischemic to hemorrhagic stroke. Of course, clinically and during an MRI scan or a CT scan, we do need to distinguish between an ischemic stroke and a hemorrhagic stroke, because the treatment of the two is very different. You must have heard neurologists saying time is brain, treatment denied is treatment delays is treatment denied. Why do we say all this? We say all this because we have treatment for all strokes. If you come to us in time, most of you will have heard about the clot bursting agent, which is called TPA, which can be used in the first 3 hours, 4.5 hours. It doesn't just stop there. Even if you come to us till 12 hours, we could still help you out in treating the stroke. Now, you must be wondering that have the risk factors of stroke changed? Has the type of stroke changed with COVID-19? It's not true. First, the risk factors of an ischemic stroke or a hemorrhagic stroke remain the same. Diabetes, hypertension, hypercholesterolemia, oral contraceptives, sedentary lifestyle. They're all risk factors for stroke, whether you have an ischemic stroke or whether you have an hemorrhagic stroke. In the same way, the same risk factors exist for COVID-19 and stroke. The same methods of treatment which we use are the same methods used for COVID-19 patients who were a stroke. Just to tell you in short, that we had a lady who was only 53. She had no diabetes, no hypertension. She came one night with a stroke on the left side. We did an MRI. The MRI showed multiple infarcts in the brain. As a routine, we sent a COVID-19 test, which was positive. Obviously, there were no other symptoms she had. She had no fever, no chest symptoms, no loss of smell, no loss of taste, nothing. Her presentation was an ischemic stroke, and she was COVID positive. Now, what do? One, in the Wuhan study in China, it was shown that about 4 to 10% of patients of stroke present with the stroke when they have no symptoms of COVID-19. So this is one of our patients. She was adequately managed by the conventional way that she managed stroke, giving her antiplatelet agents, giving her anti-statins, and she made a reasonably good recovery and will be discharged from the hospital. The other side is that you have a patient who has diabetes, who has hypertension, other comorbid conditions. She comes to you with features of COVID-19, chest infection, etc. And then she develops a stroke. So, you can realize that there are two different situations. This is the patient who's a COVID patient, who has had chest infection and now has developed stroke. And this stroke, one, either is totally related to the comorbid condition of diabetes, hypertension, age which the patient has, or it is directly related to the COVID-19. How could that be directly related to the COVID-19? We know that the COVID-19 produces a lot of abnormalities of clotting, and it produces an increased chance of thrombosis or clot. Again, does the management differ in the two types? Certainly not. In fact, some patients of COVID-19 who had a stroke have even been thrombolized. Unfortunately, we have not done that as yet. It has to be done under strict precautions, but I would prefer that if a person has a stroke with comorbid conditions, is thrombolizing him, doing thrombectomy, would be better to put him on antiplatelet agents and treat him. See, I would like to stress upon the fact that the management of stroke doesn't drastically differ in the COVID patients. I think these COVID patients in the ICU need to have more care, and let us hope and see that they do not develop complications of stroke, which I would mean that they do not develop chest infection, which they are prone to. They don't develop a deep venous thrombosis, because if they develop other complications of stroke, they will deteriorate very fast. So friends, don't worry. If you even have a stroke in the COVID days, we still can help you, and we will help you. And we have all methods to help these patients of stroke and COVID-19. But I would also like to stress a very important point. That is, please, even if you are a stroke patient who's COVID negative, you need to go to the hospital. Please remember that because of the COVID-19, for the last couple of months, the normal neurological emergencies are getting ignored. What are the normal neurological emergencies? Strokes, meningitis, brain fever, accidents, and what we use the word encephalopathy in the elderly. Please remember, it is not that stroke has come down. Because if you ask me, have the number of patients of stroke coming to the Indraprastha Hospital decreased? The answer to this is yes. But I would not say that the stroke has decreased. They are not coming to the hospital for various reasons. And that is why what I am going to stress. And those reasons are that there is a scare in the patient and his relatives' mind that if you go to a hospital, you might get COVID infection there. Hence, the patient is not brought to the hospital. I can assure you through this chat that we at the Indraprastha hospitals have very clearly demarcated COVID and non-COVID areas. The non-COVID area, everything is different. The COVID area is a clean area. So be rest assured that if you have an emergency, you should still go to the hospital where you can get good medical care. And don't be scared about COVID, because we are here to look after you, that you don't get infection. I have a question coming up here from Devendra Kumar Sharma. Sir, can you update on if a patient is acutely ill with COVID, which is the best vascular device for the patient in ICU? Best vascular device, what do you mean by that? What sort of device are you talking about? You're talking about a vascular access, which is the best vascular access device for a patient in the ICU. I'm afraid as a neurologist, I may not be able to answer this question for you very correctly, because I may not know. But I suppose when you have to have a vascular access, when you have to have a vascular access means that you won't have a line, whether you want to have an arterial line, you want to have a venous line for giving the patients fluids. Well, that is not decided by me as a neurologist. What access and what device you would be decided by the critical care team. So I think that is a question which I really can't answer for you, because I'm a neurologist and I can answer any part of COVID and stroke. Now the next part is that does COVID-19, in addition to stroke, produces other neurological signs and symptoms? I will answer that question very simply. After COVID-19 is a viral infection, maybe it's a different virus. We see lots of virus infections. Sometimes we don't even know what we are treating. So the other neurological complications COVID virus could produce could be one. It could produce what is called peripheral neuropathy. By peripheral neuropathy, we mean that there is involvement of the nerves of the hands and legs. Now, it may not be a matter of great concern at the time when you are treating a patient of COVID who's on a ventilator. What you need to first do is to let the COVID specialist take care of the other part before we start talking about the peripheral neuropathy. COVID has also been associated with dementia. We're all used to the word dementia. Dementia is a progressive memory loss, and this memory loss, I don't know, because I don't have any experience to say whether it improves itself over a period of time. But as we are seeing more and more COVID patients, hopefully we should see lesser and lesser COVID patients now. Hopefully we should get to a peak of the treatment. We are seeing more and more complications of the peripheral nervous system, which means a nerve, and complications of the central nervous system, which is the brain the dementia. And complications of the peripheral nervous system would involve the complications of the spinal cord and the complications of the peripheral nerves. Now, let us stress a little a question which we are asked very often. I am asked as a neurologist. I have a patient who's 65, who's a diabetic, who's a hypertensive. Suppose he develops a stroke. Can you prevent a stroke? Very good question. Now, yes, you can to some extent. Like you can prevent a stroke for a person who's had a stroke or a person who's had a minor stroke. In the same way, a person above the age of 60s who has comorbid conditions like diabetes, hypertension, they should start themselves on aspirin and statins, in addition to the control of diabetes and hypertension. Now, I would say that it has not been proven this yet, but I'm sure it stands to logic that people who have other comorbid conditions, we should do whatever we can to prevent complications of stroke or other neurological complication if they develop a COVID-19 infection. So certainly, good lifestyle, good food, antiplatelets, statins, maintenance of diabetes, maintenance of hypertension would definitely prevent stroke, and it also prevent maybe the severity of the stroke. So I think that's very, very important. That if we have elderlies, everybody has elderlies in his house or her house, we should take care of them in this way to see that they don't develop superadded complications of COVID. The risk factors of stroke for COVID-19 are the same as the risk factors of stroke as you see. Now, I always talk about two types of risk factors: modifiable and non-modifiable. Modifiable risk factors are those which you and I can modify, which you and I can treat. Non-modifiable risk factors are which you and I can do nothing about it. So what are the non-modifiable risk factors first? You can't do anything with your age, it has to come. You can't do anything with your sex. You can't do anything genetics. So these risk factors are non-modifiable. There are types of strokes which have a genetic predisposition, and I and you can do nothing about it. But practically, they're just the 3 of 10. If you come to the other part, modifiable, if you modify these factors, I can assure you that you can prevent a cerebrovascular disease in a very high percentage of patients. Please don't be casual about it. You tell a patient, you got hypertension. He doesn't accept it. Please remember that if you have hypertension, if you have a persistent hypertension, if you have an increased systolic and diastolic blood pressure, if your diastolic blood pressure continues to be high, you have a 40% higher chance of having a stroke. So first is to accept that you have hypertension. 2 is to take the medicine regularly. 3, take less salt, do regular exercise, cut down your intake of fats. The first thing which you have to accept, that you have it, and you want to treat it. Just ignoring it, just say I don't accept it is not the answer. The second catastrophic modifiable risk factor is diabetes. Please don't be under the impression that diabetes cannot be controlled. If you go to the right time, right place, take the right medicines, do regular exercise, do diet control, your diabetes will be controlled. And I can assure you, all the complications of diabetes occur, especially cerebrovascular, which means heart disease, brain disease, and disease of the peripheral blood vessels occurs in people who have uncontrolled diabetes. So you've got 2 major risk factors here. The third one, which is again very easy to monitor, is cholesterol. You must see your HDL, which is the good cholesterol, the LDL, and see that they are regular monitored. And you should take regular statins if they are required, because statins not only decrease the thickness of the walls of the artery, but they act on the vessel wall that is called the endothelial vessel. They decrease the endothelial dysfunction. They act also on the inflammation of the endothelium. So it becomes extremely important that if you take care of these 3 things with just 2 more things, if you could do modulation of lifestyle. I'm sure anybody will say Dr. Renjen is talking bunk. I'm not talking bunk. It's very easy, but you have to have determination that I'm going to modulate my lifestyle. I eat correctly, I sleep correctly, I do my exercises correctly, and I can assure you, if you modulate your lifestyle, leave your sedentary lifestyle, cut down on the intake of alcohol and smoking, you will be able to significantly decrease the incidence of cerebrovascular disease. Friends, I'm not scaring you. The WHO has come out with figures which says that in the developing world like ours, if we are not able to manage our modifiable risk factors, stroke will take an epidemic proportion in this country. And that is why we as neurologists don't want it to happen. In whatever way we could, we're going to do our best to spread the message, to spread the awareness of stroke. That's why I said it's always nice to look at some of these meetings and some of the literature and some of the lectures which are coming regularly on the YouTube channel, Stroke Neurology. Please go watch, comment, and if you have any questions, you're most welcome to me and we'll get back to you. I will end by saying that COVID-19 and stroke, anything, please be aware or the risk factors, please be aware that you require immediate medical help to a hospital where you could be given these facilities. Thank you very much.